Hi, this is Shannon, and this is my article review of the effectiveness of acupuncture for carpal tunnel syndrome. So the design is a cross-sectional study that was done over 6 weeks. They did a baseline before any treatment or intervention was involved, and then post-treatment at the end of the 6 weeks. There was also a 2-week post-study evaluation, as well as a 4-week post-study evaluation that I'll go into a little bit deeper. But those 2 weeks post-study was just to determine the effectiveness of the treatment. Methods. So they had 40 participants initially. 14 dropped out due to time constraint or discomfort of the intervention. There were 2 different groups. There was the traditional acupuncture, which is kind of seen as the control group, and then the electroacupuncture, which was the real focus of the study, if you will. So prior to any data collection, participants filled out the informed consent, as well as did the Low and Chang's questionnaire. It's a patient-rated outcome. In the article, it doesn't really discuss if it's a validated tool or anything specific about the questionnaire. It does say that the patient rates their symptom scores, functional abilities, and overall well-being. But the article was pretty vague about this questionnaire, so that's something to take into consideration here. Needles that were used were all sterile, disposable needles with a 0.35 centimeter diameter and 12 millimeter length. And all needle locations were at the PC7 with 0.25 to 0.5 centimeters in depth, and at PC6 at 0.5 to 0.75 centimeters in depth. So the participants did a total of 24 sessions of 15-minute duration over 6 weeks and did 4 sessions per week. And from there was a reevaluation at 2 weeks after completion of the treatment in the study. And that was for all parameters except for the electrodiagnostic study, which was at 4 weeks post-study. So variables, our independent variables was the traditional acupuncture and electroacupuncture with 0.8 MA and 2 Hertz current. And then, like I said before, needles were at the PC7 and PC6 locations. Dependent variables was the electrodiagnostic study to see nerve conductivity, the symptom scores, symptom severity assessment, grip strength, pinch strength, 2-point discrimination evaluation, provocation test, Tinel sign, and Phelan's test. So the results from the study, they found that Tinel sign decreased with acupuncture, there was a decreased symptom severity and functional status reported by the patients in both groups, but was greatest in the electro group, but was no distinct significant decrease was between the two, but they just wanted to note that there was a greater decrease in severity score in the electro group. Grip strength also increased in both groups, but was significant in the acupuncture group, and there was no changes in the 2-point discrimination. There was an increased nerve conduction of the electrodiagnostic study when gripping the acupuncture group. And at the end of the research study, they wanted to make sure that there is more research needed. So here's a quick look at the table of the pinch, grip, and regular grip and 2-point discrimination. You can come back and look at that and pause next time. And here is a table of the electrophysiology study of that diagnostic accuracy, where we did see an increase in the acupuncture group. So clinical application, electroacupuncture can alleviate clinical symptoms. Traditional acupuncture could improve grip strength, decrease provocation signs, and improve nerve conduction function. So overall, acupuncture does work. Now, determining between electroacupuncture versus traditional acupuncture, Still in the works, but we do know that acupuncture is beneficial for carpal tunnel patients. So the real question here is this something that you would be suggesting for your patients? If you have any questions or comments, please feel free to contact me at sro9@sycamores.indstate.edu. Thank you so much. Have a great day.